Imagine stepping onto a stage at Lincoln Center. The orchestra swells, you take a breath, and you go to hit a note that you've sung flawlessly for like 30 years.
Right.
A note your entire career, your livelihood, your whole identity is built on. And suddenly the sound just, it isn't there. It shatters like glass.
It's a terrifying thought, honestly.
It really is. And today, we are looking at a hidden symptom of an entirely natural biological process. We are examining the voice. So welcome to the deep dive. Our mission today is to answer a surprisingly complex question for you. Can menopause cause or, exacerbate vocal changes like a loss of vocal range or hoarseness?
And specifically, what happens when this strikes professional singers, right? People whose vocal cords are literally elite athletic instruments.
Exactly. And to map that out, we've pulled together a really fascinating stack of sources. We're looking at clinical practice guidelines on hoarseness, medical studies analyzing hormone replacement therapy, emerging pelvic health research, and a deeply revealing doctoral dissertation by B. DeMaio.
Yeah, that dissertation is incredible.
It features in-depth interviews with 19 elite world-class female singers.
Those interviews are particularly vital. I mean, they really bridge the gap between sterile clinical data and the intensely physical lived experience of losing vocal control. They give us the acoustic reality of the hormonal shift.
Okay, let's unpack this, because if you're going to understand how a voice seemingly breaks overnight, you really have to look at the architecture of the throat itself. The vocal folds aren't just, pieces of string vibrating in the wind.
No, no, no.
The larynx, the voice box, is essentially a hormonal target organ.
That is the foundational concept here. The tissue of the vocal folds is packed with specific receptors for estrogen, progesterone, and androgens. From puberty onward, those tissues are constantly, reading hormonal signals.
To figure out what to do next.
Basically, yeah. They read the signals to determine their own structural density and mucus production. And estrogen acts as the primary architect here. It maintains the mucosal layers, promotes glandular mucus secretion, and ensures robust capillary permeability. So the tissue stays highly oxygenated.
I actually found an analogy in the sources from a singer who captured this perfectly. She compared estrogen to the oil in a car engine.
Oh, that's a great way to put it.
Right. Estrogen is the body's systemic moisturizer. As long as the oil is circulating, the engine runs flawlessly. The vocal folds stay plump, they remain incredibly flexible, and they're highly hydrated.
Which allows them to vibrate hundreds of times per second without friction.
Exactly. But when the estrogen drops in midlife, the oil pan essentially runs dry.
What's fascinating here is how deeply that cellular mirroring actually goes. Dr. Jean Abbott-Ball, who is a leading figure in vocal research, demonstrated this beautifully.
Yeah, the smear test study, right?
Yes. He took cytological smears from the vocal folds, literally swabbing the mucosal cells and putting them under a microscope, and found they are virtually indistinguishable from cervical smears.
Wait, really? They look identical.
Identical. Both tissues consist of stratified squamous epithelium that relies heavily on estrogen for cellular turnover.
So just to be clear, the cells in the throat and the cells in the cervix are functionally reacting to the exact same biological clock.
Precisely. As estrogen drops, the vaginal dryness and tissue thinning that are, hallmark clinical symptoms of menopause, they are happening simultaneously in the throat.
Wow.
The vocal mucosa loses its pearly, hydrated appearance. It becomes dull, thin, and significantly more susceptible to microtrauma from just the everyday friction of speaking or singing.
But the sources emphasize that it isn't just the absence of estrogen causing the disruption, right? It's the shifting ratio of the hormones left behind, specifically the androgens.
Right. The androgen shift is actually the primary mechanical driver of the pitch changes we hear. Women naturally produce androgens in their adrenal glands and ovaries.
Like testosterone.
Exactly. And normally, high estrogen levels counterbalance those male hormones, but when the estrogen plummets, those androgens are suddenly operating without opposition.
They have free rein.
They do. And because the vocal folds also have androgen receptors, this unopposed stimulation signals the vocal fold muscles to actually increase in mass.
So they become physically thicker and heavier. And, basic acoustic physics tells us that if you increase the mass of a vibrating string, the frequency of that vibration slows down.
Which yields a measurable drop in speaking pitch. The clinical data shows an average drop of about 14 hertz.
Which is, about one musical semitone?
Roughly, yes. And the overall timbre of the voice becomes rougher, huskier, and just fundamentally deeper.
In the clinical literature, This whole constellation of symptoms has earned its own classification, right? Menopausal voice syndrome.
Yes.
And studies show that 46% of postmenopausal women experience some form of noticeable voice change.
Nearly half the population.
Nearly half. And the clinical reality goes far beyond just a deeper speaking voice.
Oh, absolutely. The symptoms are highly disruptive. Patients report severe throat dryness, a feeling of a lump in the throat, rapid vocal fatigue, and a really pronounced loss of vocal flexibility.
But mechanically, the most problematic symptom for singers seems to be breathiness.
Yes, breathiness is a massive issue.
Let's break down the mechanics of that breathiness. The sources describe a condition called vocal fold bowing. Because the tissue has lost its estrogen-driven plumpness and the muscle tone has shifted, the folds they don't meet cleanly in the middle anymore.
Imagine two straight edges that are supposed to press tightly together to create a seal, resisting the air coming up from the lungs. With bowing, they curve slightly away from each other in the center.
So there's a gap.
A constant gap. Because they don't achieve full glottic closure, unfinated air just constantly escapes. You lose volume, you sound breathy, and your subglottic pressure plummets.
Subglottic pressure being the air pressure you need to build up below the vocal cords to actually project your voice.
Exactly.
So you essentially have a leak in the tire. You have to work twice as hard to push air through the system just to achieve a normal speaking volume.
Which is exhausting.
Yeah. And that brings us to the professional stakes. The dissertation interviews with those elite opera and Broadway singers, it outlines a brutal reality. We are talking about women who have headlined the biggest opera houses in the world, dealing with this exact mechanical failure.
The psychological toll of that must be immense, especially given the sheer demands of classical repertoire.
It is entirely destabilizing. The legendary mezzo-soprano Christa Ludwig was quoted saying that during those menopausal years, her vocal cords felt like they were, quote, made of glass.
Wow. Made of glass.
Yeah. She lived in daily fear of singing a forte, a loud, unsupported tone, terrified the tissue would just shatter under the pressure.
That is heartbreaking.
And Brigitte Fassbander, another highly acclaimed singer, pointed out the unforgiving nature of the industry. She noted, you have one evening when 5 tones are not so under control and you're out.
Because the margin for error in elite classical music is virtually zero. I mean, you are attempting to navigate a fundamental cellular shift in your larynx, yet the acoustic expectation from the conductor and the audience remains fixed on the instrument you possessed at age 30.
Right. But here's where it gets really interesting, though. When I was analyzing these interviews, a major paradox jumped out.
Oh.
Yeah. The general medical consensus, and even common sense, dictates that a thicker, heavier vocal cord from the androgen shift means a loss of high notes. Right.
Sure. Heavier mass means you can't vibrate as fast for the high pitches.
Exactly. But in this dissertation, the classical operatic mezzo-sopranos specifically complained of losing their low notes.
Wait, losing the bottom of their range, that completely challenges the standard assumption of the 14 hertz drop.
It totally upends it, but it highlights how intensely individual this biological shift is when you factor in specific vocal technique and a singer's FAC, or voice category.
Ah.
Operatic mezzos are trained to use a head-dominant mix throughout their entire range to maintain a really smooth, homogeneous tone. They don't just belt out raw chest voice on the low notes.
Right, they blend the lighter head resonance into the bottom of their range.
Exactly.
So it is an issue of fine motor control between the laryngeal muscles.
Exactly that. The thyroarytenoid muscle, which governs chest voice, thickens from the androgens. It becomes heavier and way more dominant. But the cricothyroid muscle, which stretches the folds for head voice, struggles to manage that new bulk.
Oh, I see.
So when the mezzo tries to smoothly transition down into her lower register, using that delicate mixed coordination she's practiced for decades, the heavier chest mechanism essentially just bullies its way in. The fine-tuned muscular balance collapses.
That is a brilliant mechanical explanation. The instrument hasn't just deepened. The calibration between the muscle groups has been completely scrambled.
Right.
But this variance in experience leads us to a really critical physiological question. Why is this so heavily individualized? We know certain sopranos sail through their 50s with their extreme upper registers perfectly intact, while others face, early retirement.
Well, if we connect this to the bigger picture, we have to look at the body as an interconnected endocrine system, not just a collection of isolated parts.
Okay.
Dr. Abitbol introduced a fascinating concept here, the Modigliani versus Rubens phenotype.
Yes. This is where endocrinology meets anatomy in a really elegant way. So think of the slender, highly angular women in a Modigliani painting, right? Possessing very little body fat.
Okay.
Contrast that with the women in a Rubens painting, characterized by rounded figures and higher amounts of adipose or fat tissue. It turns out that adipose tissue is not just dormant fat, it is highly metabolically active.
I was actually reading through the mechanism for this, and it involves an enzyme called cytochrome P450, right? Explain how this actually protects the voice.
Sure, so cytochrome P450 resides within the fat cells. Its primary job in this context is aromatization. It basically takes the androgens circulating in the blood, specifically androstenedione, and chemically converts them into estrone.
Which is a weak form of estrogen.
Exactly. So women with a Rubens phenotype basically possess a secondary localized estrogen factory right in their adipose tissue.
So even after the ovaries have completely shut down estrogen production, their fat cells are providing a steady, low-dose estrogen drip directly into their system.
Which means their vocal folds continue to receive the biological signal to maintain mucosal hydration and tissue density. They are essentially insulated against severe vocal atrophy.
While the thinner Modigliani women lack that backup estrogen source and experience, the tissue changes much more acutely.
Exactly.
So retaining a bit of extra adipose tissue in midlife might actually be a profound evolutionary advantage for preserving vocal function.
It really seems that way.
But, I want to push back on the sources here for a second because I feel like we run the risk of developing tunnel vision. Well, when a 55-year-old woman develops a hoarse, breathy voice, are we too quick to just label it menopausal voice syndrome?
Ah, that is a very fair point. It is a dangerous clinical trap to blame everything on estrogen withdrawal. You really have to isolate menopause from presbylaryngeus, which is just the baseline aging process of the voice box.
Right.
By age 65, the laryngeal cartilages, which were highly pliable in youth, they naturally ossify. They calcify into bone, reducing the overall mobility of the larynx.
And the respiratory system is failing to support it too. The sources note that between the ages of 40 and 80, a person can lose up to 40% of their vital lung capacity.
40%. The bellows driving the sound are almost half as weak. So even if the vocal folds were perfectly preserved in amber, the acoustic output would still diminish because the subglottic pressure is compromised.
Furthermore, the clinical guidelines emphasize that midlife triggers a whole cascade of other systemic issues that mimic menopause perfectly,
No, definitely.
like thyroid shifts, particularly Hashimoto's or general hypothyroidism, which really peak in women in their 50s. A sluggish thyroid causes fluid retention and profound edema swelling in the vocal folds. The voice becomes deep, gravelly, and fatigued.
And treating edema with estrogen would be entirely ineffective, perhaps even counterproductive. I mean, the pathology is completely different.
Exactly.
Yeah.
And the other massive masquerader here is laryngopharyngeal reflux, or LPR, silent acid reflux.
Very common.
Yeah, as our digestive motility slows down with age, stomach acid and pepsin routinely splash up through the esophagus and literally bathe the vocal folds. The primary symptoms of LPR are hoarseness, the sensation of a lump in the throat, and a constant need to clear mucus.
Which is the exact clinical presentation of menopausal voice syndrome.
Right.
If a physician doesn't properly scope the patient to differentiate between mucosal atrophy from low estrogen and chemical burns from stomach acid, the patient is just left treating the wrong disease entirely.
So what does this all mean for you, the listener? If the acoustic changes are properly diagnosed as hormonal, how do you reclaim the voice? The most heavily debated clinical intervention in the literature has got to be hormone replacement therapy.
It is. And from a strictly localized acoustic perspective, HRT is highly efficacious. The clinical data confirms that administering systemic estrogen can actually halt the 14 hertz pitch drop.
Really?
Yeah. It revitalizes the glandular secretions, restores the pearly sheen to the mucosa, and visibly reverses the bowing caused by muscle atrophy.
So it literally puts the oil back in the engine and rebuilds the seal.
It does.
But the sources are meticulous in warning that HRT cannot be prescribed in a vacuum. It carries serious systemic implications, requiring a rigorous evaluation of cardiovascular risk and breast cancer history. I mean, you don't risk systemic health solely to preserve a high C.
Exactly. It requires a deeply holistic calculus between the patient and their endocrinologist.
But for those who cannot or just choose not to utilize HRT, the physical therapy interventions are incredibly robust. I actually want to look at the voice-to-pelvic floor connection, the V2PF, because the anatomical research on this is stunning.
Oh, the integration of pelvic floor physical therapy into vocal rehabilitation is probably one of the most significant advancements in modern speech
Yeah.
pathology.
Unpack the mechanics of this for us,
Yeah.
because it sounds wild. How does releasing tension in the pelvis fix a breathy voice in the throat?
I know it sounds disconnected, but it comes down to the deep front line of the body's fascial network.
Okay.
The fascia is the connective tissue enveloping our muscles, and there is a continuous fascial pathway linking the pelvic floor, traveling all the way up through the respiratory diaphragm and attaching directly to the root of the tongue and the laryngeal housing.
So they are literally tethered together.
Yes, physically tethered. When a singer experiences vocal fatigue or breathiness, their instinct is often to push harder from the neck, right?
Mm.
Creating severe laryngeal tension. Simultaneously, they often lock their abdominal and pelvic floor muscles in an attempt to just force the breath out. But by deliberately releasing the pelvic floor and engaging in deep diaphragmatic breathing, you lower the intra-abdominal pressure.
And that release travels up.
Exactly. This mechanical release travels up the fascial line, physically pulling the larynx down into a neutral, decompressed posture, which allows the vocal folds to vibrate without extrinsic muscular strain.
Wow. You stabilize the instrument from the ground up.
Precisely.
And alongside that physical therapy, the sources really hammer home the necessity of extreme vocal hygiene. Because the biological moisture is compromised, you basically have to engineer it externally.
Hydration, hydration, hydration.
We are talking aggressive systemic hydration, drinking half your body weight in ounces of water daily, running humidifiers continuously, and ruthlessly eliminating drying agents like antihistamines and excessive caffeine.
You are manually compensating for the loss of the glandular mucus blanket.
Right. And the final piece of the rehabilitation puzzle comes straight from the elite singers themselves. It's the absolute necessity of vocal fitness. The overarching philosophy is use it or lose it.
Because the intrinsic muscles of the larynx obey the exact same laws of atrophy as a bicep or a hamstring.
Oh.
A sedentary voice ages exponentially faster than an active one.
So the singers who maintained rigorous daily vocal conditioning utilizing exercises like lip trills and vocal sirens, they actually demonstrated an ability to delay or even reverse age-related acoustic decline.
Yeah, those specific exercises, semi-occluded vocal tract exercises, are vital. By creating a partial seal at the lips during a trill, you create back pressure in the vocal tract.
And what does that back pressure do?
That acoustic back pressure reflects down onto the vocal folds, lightly massaging them apart and stimulating immense blood flow to the tissue, which keeps the muscle fibers robust even in a low estrogen environment.
So is localized resistance training for the throat. And reading how these women implemented these strategies completely shifted my perspective on the dissertation. I went into it expecting a tragedy, anticipating 19 stories of shattered careers. But none of these elite singers actually ended their careers because their vocal cords failed them.
Right, they circumvented the biological barrier entirely. How did they adapt professionally?
Well, they evolved their artistry. Many transitioned their repertoire, abandoning the stratospheric soprano roles that felt fragile, and leaning into roles that demanded a richer, darker, more complex timbre. They utilized the androgen shift to their advantage.
That's brilliant.
Others transitioned into elite pedagogy, becoming master teachers. The tragedy only really emerged in the researchers' conclusion about why women actually leave the stage. It was rarely due to a broken instrument. It was due to the systemic ageism of the theater industry.
So the biological instrument matured into a new resonance, but the commercial industry just refused to write for or hire the evolved acoustic profile.
Exactly. We have a profound cultural intolerance for the aging female voice. We expect a 55-year-old woman to output the exact acoustic frequency of a 25-year-old. If the industry celebrated the darker, heavier resonance that comes with midlife, this transition would be an artistic evolution, not a medical crisis.
That really reframes the entire narrative, doesn't it? The voice is not failing, it is simply adapting its physical geometry to a new endocrine reality.
Which brings us back to you, the listener. The voice is a living, breathing barometer of our internal health. Whether you are a lawyer projecting across a courtroom, a teacher managing a classroom, or just someone who relies on their voice to connect with their family, your vocal cords require proactive maintenance and, honestly, grace as they change.
This raises an important question for all of us, really. How closely are we actually listening to the biological data our bodies are broadcasting? A raspy throat or a sudden loss of pitch isn't just an inconvenience. It is your endocrine system, your thyroid, or your digestive tract trying to communicate a systemic shift.
It is an internal alarm bell ringing right in the center of your throat. Which leaves me with a final provocative thought for you to explore on your own. We live in an era obsessed with physiological tracking, right?
Oh, completely.
We wear devices that monitor our sleep architecture, our blood oxygen, our heart rate variability. We track our bone density and our cholesterol as we age. But we almost never track our acoustic footprint.
That's very true.
We have no baseline for the specific frequencies of our own sound. But what if we treated the voice as a primary vital sign? If our vocal mucosa perfectly mirrors our internal cellular health, if it reacts to every hormonal dip, every thyroid fluctuation, every shift in hydration, perhaps in the near future, a simple 10-second daily voice recording could be the ultimate diagnostic tool.
That is a fascinating idea.
Right. An algorithm analyzing the microscopic changes in your vocal shimmer and jitter could predict exactly where you are in your biological aging process long before you ever feel a hot flash or a symptom. So the next time your voice cracks, or you feel that sudden gravelly weight in your throat, don't just clear it away and ignore it. Stop and listen. Your instrument is trying to tell you exactly how you are tuned.